Hello, ladies and gentlemen. This is Steven again. It's around 5:30 almost, 5:28. I'd like to make a video today about Cindy and I. Okay. They've sure been doing a lot of road work and everything around our area and everything, tearing up early in the morning, not supposed to work till technically 8:30 in the morning, pounding and grinding, pumping and grinding. No kidding. Around 6 a.m. in the morning, jackhammers going on and putting in pipelines. Arizona Pipeline. My brother-in-law, he works for the company and owns the company almost. We could say that anyway. He practically owns the company. He's been there for more than 30 years. But anyway, I want to talk a little bit about benzos today. A little bit about depression and anxiety, what the difference is and stuff like that. Panic attacks and it's anxiolytics drugs. Okay. What they're good for and what they're not good for. Okay. That's what I want to talk to you about. Okay. This is the bottom line of how it works. Okay. Okay. Usually when a doctor sees you, okay, he assesses you. Okay. And when they do assess you, they don't take much time with you. A lot of doctors don't. I realize that because they don't have a lot of time on their hands. They got to go to the hospital. I'm sorry, guys, if I talk or ramble a lot. I'm just going to tell you the truth. Nice and sweet. Okay, a benzodiazepine, which I've described in the past. This is all about benzo, nothing else. Okay, maybe one more thing. Okay, a serotonin reuptake. Okay, which can cause suicide. Okay, if you have too much of it. You'll understand what I'm talking about when I get to it. Okay, I'm gonna tell you why people commit suicide. Okay, hardly anybody knows, and doctors still are studying this today. Anyways, let's get to the point. Okay, when you have a person that is shaking really bad, okay, even a person that has a mental breakdown, for instance, okay, they get stuck in the hospital, they're in a lot of pain, okay, they're not listening to the doctor. Let's just say that. They're not listening to the doctor's trying to instruct them what to do, calm down. Okay, there's so much pain they can't calm down, right, guys? Listen, I'm tell you a secret. It's not really a secret. You should know this too. Okay, this has happened to Cindy. Okay, I'm gonna tell you the truth. Listen to me carefully. Okay, it's not that she's crazy, guys. Listen carefully. I care about Cindy more than you can imagine. I love her. Okay, now this is about love. This is about companionship. This is about help. This is about everything, okay? I feel like I'm on a debate or something like that from earlier about defriending somebody, okay? And somebody defriending me, okay? Have to go through debate, just like the President of the United States gone through a debate with his opponent. That's so stupid. But anyway, it's stupid to argue about something that your doctor gives you that you continue on taking when you're supposed to take it. And then you have some pity-ass wannabe nurse, tell you to quit taking the drug, withdraw the drug from your life just because she cares about you or claims they like you or love you. Okay, just keep that on the record. Okay, now I'm going to change the subject. Now, back to reality. Just want to clear that up, get that off my chest. Thank God she's gone. Thank the Lord. Okay, and I wish all she is, guys, I'm going to say it, is a whore. Okay, now I said it, and people don't like me for saying it. Oh well. Okay, now that I said my piece, I'm sure Cindy's smiling in the background because I said whore. Okay, I said because she's done somebody wrong, and a lot of people like Wolf a lot. I will give a name, and I am going to tell the truth. Because I don't think it's fair to withhold information from anybody that's hurting out there. Okay? You know who I'm talking about. I mean, he's had a lot of problems, the poor guy has in the past. For Christ's sakes, the guy has open heart surgery. 5-way bypass. Death in the face. Okay? Now let's get past that. This ain't about that. Let's get back to my story. Okay, now benzos. Okay, now Benzos are used for sedative. Okay, I'll tell you about the story about what happened to Cindy now. Okay, she was going batty. Okay, I was calling her crazy. Okay, so they gave her a shot of this stuff called haldol. Okay, now haldol is classified as a drug. See, I don't have to look at a book or look at Google. I know exactly what this is because I'm into drug reps. Listen carefully. Haldol is very effective in situations of psychotic, not saying she is, sorry Cindy, psychotic episodes of
jelly rolls.
Jelly rolls.
You all hear that called jelly rolls?
No, it's out of control, like when you're having sex. And, whoops, shut up, Stephen. Okay, out of control situations whenever you can't control your hormones. Joking, just joking. No, you get out of control so much, you just keep on rolling around, you know what I'm saying? Let's get back to reality, no more bloopers. Now, really, if you're out of control, let's try that for the record. Cut, restart, okay? Okay, let's start over. Okay, anyway, yeah, they give you a shot of haldol, and they gave her a shot of haldol. She was feeling really good after that. She went right to sleep. Went to sleep. Oh, Lord have mercy, did they? She was sleeping like a baby, and when she was first born, became Christian. I mean, sleeping like a little tiny baby. I come in with my Coke, going down to the cafeteria, talked to a few girls on the way down, came back up, you know, because they know me, of course. All the girls do. Almost every girl in that hospital knows me. Sorry to brag. Not just girls. Doctors knew me. Nurses knew me. I don't even remember. I can't remember everybody. For people from the past that knew my mother, they says people didn't even know my mom died. Were asking me, "Is your mom okay? Oh my God, is she in here again?" I said, "What do you mean? Is she in here again?" That was astonishing. I know it's off the subject, guys, but I'd have to bring this up. I said she passed away. She's gone. You didn't know that? No, I didn't know that. And I said, yeah, she's passed away. Cancer killed her. But Cindy's in here now. She goes, oh God, now what? I said, oh, God is right. Okay, Lee, are you ready for the story? So that's what I told the nurse. And she goes, give it to me. I can hit me with the best shot. Tell me what you got. Well, I'm going to start from the beginning. I told her. Spinal stenosis, okay, which you probably know about already, because she was here many times. Okay, L1 through 5, S1 bulging disc. She goes, Jesus Christ, slow down. I said, I know, I'm going kind of fast. And she goes, bulging, huh? I said, yeah, bulging. I said, and she says, why did they give her Haldol? I said, because she was in so much pain that she wouldn't cooperate. I can't say the word very good. Cooperate, excuse me, sorry guys. I can't say that word very good. In other words, cooperate with the doctors and everything. It's a hard word for me. Sorry, I wasn't very good at English. Okay, I sucked at English. I was good at mathematics. That's why I'm good at medical. Okay, anyway, get along, do what they say. Okay. But anyway, she woke up and she goes, oh my God, where am I at? What am I doing? And I said, oh, just relax. She says, I'm in so much pain, Stephen, you don't understand, I'm in so much pain. And I said, I think we should run some more tests. So we ran tests on her, no blood clots, so that ain't that. So it's not blocking her arteries. We did ultrasounds, we did this on her, and she's clear and everything, Stephen. And I said, well, because I was there, and I had my Coke with me, and they said, geez, you should drink a lot of Coke, Stephen. I said, I know, doctors, or anything. They said, geez, much Coke you drink, I'm surprised you don't have diabetes. I said, no, I don't have diabetes, and hell, if I need a refill, as a matter of fact, I joke around with them and everything. They started laughing and everything. Then they said, we're going to do some testing and give her some Dilaudid shots, okay? Because what is she on at home? I said, OxyContin. They said, well, sorry, bud, we don't carry that here. And I said, I'm sure you guys don't, because there's too many thieves that would probably steal that from you. And they said, not just that, Stephen, that's a very expensive medication, this controlled substance. I said, so is Dilaudid. And they said, you got a point there. Yes, it is. It's locked up, though. But we carry Percocets, and I said, that's oxycodone. And Sandy said, hush, Stephen, don't be so smart. And I said, yeah, I know. I know. And to her and everything. I said, yeah, but it's true. It is oxycodone. Oxycodone is OxyContin. And they said, well, we'd rather give her something better than Percocets, because Percocets won't touch her. You know that. If she's taking OxyContin at home, and that's doing it, barely. We have to give her Dilaudid, the good stuff, better than morphine. You know what I'm saying? I said, understood, doctor. You give her 2 points or 2 milligrams, right? Yeah, 2.4 milligrams, whatever it is. And I had to give her doubles, and just to make her feel good. And now she's in la la land, la la la. And boy, was she with la la la. She felt good. And the doctor was even saying la la la. It's funny. He started laughing, and I started laughing. He comes in, says her INR is 2.4. It was good, a little bit above, where normal. Well, not really, because 2 and 3 is normal. But anyway, a benzodiazepine. He asked her. He says, "How many times a day do you take your benzodiazepine, which is your Xanax anxiolytic?" And she says 2 milligrams 3 times a day. And he goes, okay, there's nothing wrong with that. You should continue that. Never alter the medication. If you alter that medication, it's very dangerous. Never, ever alter any benzo. I said, now. Because I said, yeah, doctor, that's because you could have a seizure. Am I correct? He goes, absolutely, Stephen. You can have a seizure, he says. He said, are you a student or something? Or do you go to school or something like that? Are you in the medical business or something like that? I go, well, yeah, I'm in a medical for many, many years. Got to take care of my mother and stuff like that. And then, care and all kinds of things. And he goes, well, then you know what I'm talking about. Then I should talk to you about this. And so he talked to me about it. He talked to her because she's a patient too. He goes, can I have permission to, Sandy to talk to, Stephen about this situation? She goes, sure, certainly. He's allowed to make decisions for you, certainly. Okay, so he started talking to me, and he says, okay, well, here's the scoop, Stephen. He took me outside, and they told me about her back. He goes, Stephen, okay, serious talk, okay, doctor to doctor, almost like. He's what he said to me. Really, he joked around with me about the doctor part, but he did say that, joking around. And he goes, you understand me just like a doctor does. He says, I'm going to tell you like a doctor, like I would tell a doctor, okay? Here's how it goes. He spoke fast, too. He was seeing how smart I was. He goes, bilateral. And I said, yeah. He goes, DVT, deep vein thrombosis, like that. And I go, yeah. And he goes, okay, yeah. He uses differentials and CVC, CMP, VMPs, and like that. We're all normal and everything. The only thing I'm concerned about, Stephen, is Berger syndrome and everything like that, and vascular disease and diabetes. And he has diabetes in the family. I said, geez, wow. Yeah, I said, I think there's some diabetes in her family because she's borderline diabetic now. He goes, then you answer my question right there. And I said, yeah, the thing is, you don't take no glucophage or like that. That's what he asked me, the same thing she just said just now. And I said, well, technically she is diabetic. And he goes, okay, then you answer my question correctly. He said, we did the proper testing. This is the A1C. We did come out normal, believe it or not, even though she's diabetic, which is weird. Okay. Like you would come out, he says, not being diabetic, he said, Stephen. And then he says, okay, well, I'll tell you what, keep her on, make sure she keeps up her INR appointments, keep her on Coumadin, and do not miss Coumadin because it's very important. Your INR, timing is real important, okay, on blood clots. And he said, matter of fact, with cancer patients, this is off the subject, he said, Stephen, it's very common in cancer patients to get blood clots. Because what happens when you're breaking down, your body's breaking down, it clots differently. You see, the cells they reproduce in different patterns. He says, and I said, what do you mean? He goes, well, when you got different kinds of cancer, like leukemia, for instance, he says, I'll give you that one. He says, how about that one? I said, sure, blood cancer. And he goes, bingo, you got it, blood cancer. He said, you're very good, Stephen. He said, you're very good. He said, you have experience with that? And I said, not really, but a little bit. I said, my friend died of it, okay? She was 44 years old, okay, and I was in my 20s. And he go, what did you do? Work? I mean, who is she? I said, I work for her. I did work for her. Back then, I was really young, a lot younger and everything. She's a rich girl, okay? She's a rich lady. Okay, as a matter of fact, her husband's a brain surgeon. Okay, they're at the hospital. Brain surgeon. Okay, the best one. Okay. Anyway, get to the point. He says, you do have experience then. Okay, then you know what I'm talking about then. Okay, so what I'm going to suggest you to do is watch Cindy very closely. Honestly, with all her conditions, I'm going to tell you the truth, Stephen. Surgery is not an option right now. Okay? We cannot just go cutting in on her and open her up. The reason I'm saying that is because it's not open season. That's what he said. Open season. In other words, open season to him means, in other words, we see a patient, we just open her up and take care of it like a heart patient. Okay? Heart patients, when they have a heart attack, they have to be opened up, they have to be taken care of, right? Okay. Now, she is severe. Okay, number one, but she has Coumadin to rely on. She has the OxyContin for the pain. She has Xanax for the panic attacks. Okay, that's not going to kill you. Okay, unless you quit the Xanax. Okay, which I already explained earlier on the board, stupid board. Okay, 3, watch her. Okay, I told her, oh yeah, one more thing I forgot to bring up, Berger syndrome. He said, how do you know about Berger syndrome? I said, some doctor gave me a philosophy about it. He goes, wow. He said, I'm surprised you brought that up to me, he says. I haven't heard that in a long time about Berger syndrome. He says, you're sharp. He says, I never, ever, ever heard of anybody bring up Berger syndrome, especially a patient or somebody like you. You know, and I said, what do you mean somebody like me? He goes, well, somebody that cares about their girlfriend and, you know, is so much into knowledge in the medical field. I said, well, I'm not a doctor, okay? He goes, well, you should have a license, he says, the way you're acting. He goes, you should have a license. And I say, well, not really, doctor, because I wouldn't pass, I don't think. He said, huh. He says, I have residency students that's not even half as smart as you, okay? You could teach them stuff. They raise their hair. You're raising my hair, he says. If you can raise my hair, Stephen, don't you think you can raise my students' hair? And I looked at him, I said, you might have a point there. And he goes, you are raising my hair right now. He said, I trust you, he says. Now I'm going to trust you on one more thing, he says. Okay, after I'm going to give her another shot of Dilaudid. Okay? Don't you think that's proper treatment? I said, yes, it is proper treatment. And he goes, okay, we're going to give her another shot of Dilaudid. Okay? We're going to send her home with the best, some Percocets, a whole bunch of them. Okay? We're going to send her home with about 45 Percocets. Okay, I don't usually do this, but I'm going to do it anyway. So I'm going to write down 45. And because they're only allowed to do 10 at a time, 10 or 15 at a time. He says, because I think that she needs this and everything. And he says, do you take anything for pain? I said, I sure do. I said, I take Percocets also. He goes, good for you, he says. He says, what do you take it for, though, for Percocets for? I say, neuropathy. He goes, ooch, that's a hard one, he says. He says, the Gabapentin just doesn't work, does it? I say, bingo, you got it, Neurontin. He goes, wow, you even know the name brands, too. I said, yeah. He goes, yep, Neurontin doesn't work. And I told the neurologist everything, that my pain doesn't work. It didn't work for my pain. And he says, what did she say? I told it to her. And he says, what did she say? Absolutely nothing. Just continue, just keep on continuing taking the medication. He said, you mean tell me she said continue a medication that doesn't work? He said, that is malpractice, he says. He says, I don't do that here, he says. He said, I'm a doctor for the ER, but I said, I'll tell you one thing, if I'm on practice, he says, at a regular place, I would not do that. I would give you Percocets and something else to help you with the nerve pain, okay, which would probably be Lyrica, okay. But anyway, he said, you're taking the right medication and don't stop it, he says, especially those. Keep on taking them. He said they're good, he says. They're good, very good for spasms too, he said. And they're very good for cramping, believe it or not, for women out there. You women, there's good news. Watch the Tylenol, though. It will kill you. Bad for your liver. Okay, that's what I'm trying to tell you. And this thing, Missy, if you're out there listening, trust me. Vicodin is not being chopped off that I know of. It's just being, the FDA has a new approval thing about 300 milligrams, okay, to Vicodin. They're trying to lower it from 325 even to 300 milligrams on the fraction on the bottom, okay, for Tylenol. Okay? That's all it is. That's all it is. Just to lower numbers all. You know. But anyway, you know, nothing to worry about. Take your medicine as prescribed, not as a pharmacist tells you always to take it. If you have a question, ask your pharmacist, of course. But take it like the pharmacist or your doctor tells you to take it. If you don't quite agree with the pharmacist, call your doctor. Okay? I'm not telling you to take it the way he always tells you to take it. Call your doctor. Okay? Reps, all they do is just give you the stuff. Say, here, doctor, look at this box. This is so much better than this. You know, like lipozene, for example. Lizine and all this other stuff, fancy names. You know, all these natural herbs, stuff like that, they're coming out with now. Most of it's European medication anyway. It all comes from Europe. I'm not trying to discriminate Europe, okay? European medication, but that's all it is. Believe it or not, it works. A lot of it does. It does work. Okay, but there is medication like marijuana. It works terrific for pain, but even though there is a lot of disagreement out there, okay, nurses will disagree. There's one nurse that won't, okay, well, listen. There's a nurse out there. She smoked dope. When she smoked marijuana, she was young. Okay? She probably still smokes now. Okay, for fun. But she agrees that it's only used for euphoria. Okay? Of course it's used for euphoria because it makes you hungry. It makes you feel good. Like Percocets do. It perks you up. No, not really. Marijuana don't perk me up. If I smoked it again, if I start smoking it again, which I've been clean for a long time, off of marijuana, thank the Lord. Okay, I'm not saying bad for other people, okay? Smoke your marijuana, pop the whatever you want to do, have some fun, whatever you want to do. Not on purpose. Don't do recreational use, so. But just take it as needed, your other pills. But if you're on marijuana regimen, take it. If you're on Marinol, take it. Marinol sucks. But if you smoke it, it's better, take it. If it cures you, I mean, if it helps you, take it for MS. I mean, I'll tell you somebody right now. Very popular guy, it's on TV right now. Television, guys. You all like him. Y'all know who he is. Montel Williams. Look at him. A walking miracle today, isn't he? He wasn't even supposed to be walking today. You know why he's walking? Marijuana. That's why he's walking. Minerals, vitamins, and marijuana. It grows in, okay, Amsterdam and a lot of other places, South America. Okay, all the better spots, mountain sides, Sensimilia. I can't even say that word. I mean, there's a lot of different ones. There's so many of them. Kush. I like Kush. The Kush is a good plant. A good one. Kush. Purple haze. All the good stuff, you know. But anyway, I'm going to cut this off before I get choking on this. I want to enjoy my coffee now, so I'm going to call it I'm going to have a better day now and forget about what happened just a while ago in the past. The past is the past. Let's